Let's quickly cover acute versus chronic respiratory acidosis. As we know from nursing school, acute means it occurs over a shorter period of time, whereas chronic is something that develops over time, typically several months or longer. An acute issue is seen as more life threatening because this is a sudden change, or as a chronic condition that develops over time. Yes, it's important that we address it, but it may not be as life threatening or emergent. Sometimes your patients with chronic respiratory acidosis won't even really show any symptoms, and then you get an ABG and you're like, oh, your CO2 is super high. For example, your COPD patients. They tend to have that increased CO2, but you may not see their pH be acidotic from that CO2. And that is because over time, those kidneys have produced more bicarb to help compensate for that low pH, and that bicarb helps bring that pH up to a more normal range. So typically when someone is a chronic respiratory acidosis patient, their CO2 will be elevated. You will also see their bicarb elevated, and therefore that pH is going to typically be closer to that normal range, if not within that normal range. Now, patients can get acute on chronic respiratory acidosis where that pH starts to get more wonky. You'll see that in your patients that have COPD or another chronic condition, and then they get a pneumonia on top of it. So now it's exacerbating all of their symptoms. So I wanted to throw that little tidbit in there to help you further understand the difference between acute versus chronic respiratory acidosis.